Order. Roll call, please.
Mayor Breeden.
Here.
Mr. Blades.
Here.
Ms. Stevens.
Here.
Mr. Heyman.
Present.
Mr. Maurer.
Here.
We have 5 present. We have a quorum.
Okay, please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Councilman Heyman?
Dear Heavenly Father, we thank you for this day. Lord, we ask you that you guide us in our decisions and help in the city and to bless us in getting through this COVID experience that we're all going through. In the name of Jesus Christ, we pray. Amen.
Amen. Please be seated. Now we're going to do the approval of the agenda. Is there a motion?
So moved.
Second.
Please vote. Five ayes, motion carries.
Okay, the next item is public comment of items not on the agenda. Persons wishing to address the council on items that are within the council's jurisdiction and do not already appear on the agenda may do so at this time. Pursuant to the Brown Act, the City Council may not take action on any item that does not appear on the agenda. Speakers are limited to 5 minutes. The public comment section of the agenda is limited to a total of 1 hour. Each speaker is asked to provide his or her name. I'm going to take those online first if there are any. Otherwise, then we'll take them from the public here. I don't see any. It's okay. Is there anybody who would like to speak under public comment?
Madam Mayor, just as a reminder, you have a 20 to 30 second delay on YouTube.
Right. He was waving and telling me there wasn't any, so I will remember that, though. Thank you. Sir.
I'm hard of hearing and I'm hard of seeing, so I'm not going to be hard of speaking, so I'm dropping this mask. I don't care
Please
what
identify
anybody
yourself,
says.
Dave. Dave, please
Oh,
identify
I'm
yourself.
sorry. I'm Dave Matthews. Still,
Thank you, sir.
good to see you here.
Good to see you.
I'm going to start out with something here. Neither the wisest laws nor the wisest constitution will secure the liberty of a people that are universally corrupt. Has anybody ever heard that before? I want to know where that came from. I want to take a test later. Corrupt. Corrupt not only means the usual things that we know and accept, but it can also mean the wearing away of morality, justice, and the misplacement of power and authority. So those are some thoughts I think I'm going to leave you with tonight, and just ask you to look what's happening around this country these days, these past couple of months. There's an item on the agenda which is going to deal with the update of the coronavirus. If I ever hear that word again, I think I'm going to throw up.
Dave, if you'd like to make comments on that, can you
I
wait
will
till
wait.
that item?
I'm waiting for that, yes.
Thank you, sir.
Yes. I just wanted to bring attention to some potential phone scams. Now that I've talked about morality and so on, there is one that comes from, quote, the power company, quote, apologizing for overcharging you by a third-party institution. Doesn't name the power company, but you're supposed to press 1 and find out how you get your refund. Yeah. There's another one that actually comes from the 760 area code, which states that due to the current conditions, we are going to forgive or delete or essentially wipe out your debt. Sounds tempting, doesn't it? Of course, I know there's some people out there that are advocating for that right now, and a whole bunch of people. But I'm not going to press one to find out how to get mine canceled. I've got enough anyway, and I try to keep them paid up. Pretty much, I think, for right now, other than the update on the virus situation, is all I have. I just reiterating here, well, not reiterating, going to mention that we've got some city council offices coming up for election. It'd be interesting to find out if anybody wants to announce tonight. So with that, I guess I'll sit down for a while. Thank you.
All right, thank you, sir. Is there any other public comment? Meanwhile, public, if you're calling in, please do so at this time.
Good evening, Mike Neal. Noted Monday evening, the Indian Wells Valley Water District Board of Directors meeting, how that board is willing to actually discuss their agenda items with members of the public. They sat and listened and talked, and with one particular person went on for quite a good while until she had all her statements made and all her questions answered. Noted, boy, what a difference between that and down here, where you're basically given 5 minutes, a pat on the head, and told to go sit down and be quiet. I brought this up before, that the 5-minute limit actually only applies to this kind of public comment that I'm making, not discussion items. In discussion, people come here and think they're going to get to discuss. They're given 3, 4, 5 minutes, and that's it. They're done. So I just say that I really felt like the Water District Board of Directors gave people the impression that they cared to listen to them, and I'll leave it at that. Excuse me. And the other thing is, I'm noting on this particular agenda that at the Infrastructure Committee meeting the last time, we were told that there was going to be an agenda item about the wastewater treatment plant and the proposed location and where the council wants the plant to be. I note that that's not on the agenda tonight. It would be nice to get an answer as to why not, since we've been waiting literally for years for these negotiations to go on with the Navy, while all the time numerous people, and notably at least several on the council, have said they want it on city land, and negotiations with the Navy have just continued to go on and on and on. Members of the public have been denied information about any of that that's been going on, and now once again we don't get a chance to see it on the council agenda and have any discussion.
Thank you, sir. Is there any other public comment? Is there anyone who'd like to call in with public comment? Otherwise, we're going to give you 20 seconds and we'll say public comment is over, as I see no others. Okay, council announcements. Council, anyone who'd like to make announcements? Okay, discussion items. Update on the local COVID-19 response. Mr. Strand and I and a few others are going to make some comments. I am going to say a couple of things, and then we will go on because we have online Supervisor Gleason and Matt Constantine from the Health Department. About a month and a half ago, I sat down with Mr. Strand and Mr. Gleason and Mr. Suver and asked them, what do we do? What do we talk about? How do we find answers? And so I said, okay, I'm going to write something up. Will you guys just look at this and tell me where we go? I said, given the facts that, one, East Kern is uniquely physically separated from all of Kern County by many miles of rivers, deserts, and mountains, and that separates us from a great deal of the goings-on in western Kern County. 2, Kern County has already understood the differences between East and West Kern by establishing and funding the Kern County Air Pollution Control District and allowing the separation and funding of the East Kern Air Pollution Control District. Also, establishing the Kern Economic Development Corporation, and again, understanding the needs of East and West Kern are different, funding and establishing an East Kern Economic Development Corporation. Number 3, our COVID-19 numbers are within the governor's acceptable number increases. Number 4, the economic impact of closing so many businesses is terrible, and the economic impact that this may have on the repairs, almost $4 billion in the next few years, of the China Lake Naval Weapons Station is devastating to our military readiness and the existence of the surrounding communities. Number 5, travel in the past, both business and tourist, has been very prolific, with occupancy rates as high as 75 to 90% in our local hotels. Now, with virtually no travel, hotel occupancy rates have risen from almost 0 to 20%. And on July 2nd, 2020, the Ridgecrest Area Visitors and Convention Bureau reports 26 to 34%, depending on the hotel. We are asking Kern County to join with the City of Ridgecrest with approval of Ridgecrest Regional Hospital to ask Governor Newsom to lift the restrictions on portions of on this portion of Kern County and allow our numbers to be reported by Ridgecrest Regional Hospital to stand as our officially reported numbers in employing the concept of regional variance. I said at the time when I asked them to look at this that all this has to be fleshed out. There may be some things that are going to spring back and hurt us badly. One of them may be if our numbers go up and the rest of Kern counties don't, then, and we pass that 10% or the 3 days of increased numbers, how does that affect us? Do we want to ask for something that may bite us in the neck? I want to make sure we understand what we're asking. And it took a while for all of them. And then when the governor opened everything back up, we said, wait a minute, after we've all come to some sort of starting off point and going to the governor, I said to Mick, can you look at this again? And so Mick and Matt, would you introduce yourselves and speak to what we're talking about?
Sure, I got it. Thank you, Mayor. Appreciate the opportunity to come address you and specifically talk about this particular issue. It's, but if you don't mind, Mayor, I'd like to combine it with a couple other things, not to dilute your question, but
Please
to provide it, while we got Matt on the line, a general overview of where we are with Kern County, how things are going in a general sense. I'm going to introduce Matt in a second. I'm going to ask him also to talk about the confusion in the past week, whether we're open, closed, 3-day monitoring list, where we're going, what mistakes were made by the state in their communications, and the seemingly difficult leadership that we're having to follow. Has been frustrating and confusing for everybody, but I cannot imagine the frustration and confusion for that trickles down to the business owner who has to make decisions on his business, his livelihood, his general welfare based on miscommunications come from the state. So we're going to try to clear that. We're going to talk a little bit about that, and then we'll get on to this regional variation that you talked about, Mayor. So I brought with me, instead of me confusing everybody further, I brought the pro from Dover with me, Matt Constantine. Matt's on the line. Matt is the public health director for all of Kern County. He is the person who manages all aspects of our public health department, and including being our point man in conversations with the state and trying to coordinate the state's mandates with efforts that we're making in Kern County throughout the entire county, not just East Kern and West Kern. And Matt will also talk to us a little bit about regional variation. So, Matt Constantine, I'm passing it off to you. I want to hear from you talk about a general sense of where we are in terms of COVID-19 as a whole Kern. I'd like to hear a little bit about this past week's confusion from the state and from the governor in where we're open and where we close, when are we open and when are we closing. And then I'd like to hear a little bit about the concept that you and I have talked about on several occasions, and that being regional variation. So, Matt, over to you.
To thank you, Supervisor Gleason and City Council members. I appreciate the time and the interest. So, overall, our countywide cases continue to increase. Our average number of new cases are now into the hundreds. That is going to go up significantly. The state has given us some modeling software to use, and we track it religiously. And we are tracking along a trajectory where our cases, our hospital admissions, and our ICU admissions is going to continue to increase. This model, and it's just a model, it's always hard to predict perfectly, shows that we are going to start increasing significantly in the month of July. We will not peak until February, and we start to come down in the summer of 2021 under the current model. The model doesn't do good, isn't a great model when you get beyond, into next year, but that is the model the state is using and asking us to use. I will tell you that we are going to announce tomorrow that there are a lot of new tests coming in. People over the last 2 weeks have been testing at higher rates than we've ever had, probably a factor of more than 4 times what we normally are. So our testing rates have skyrocketed, and the labs have all been delayed. So initially we were having turnaround times of a couple days. Now it's been perhaps even a week. What that has culminated in recently for public health is we are getting a tremendous number of lab results to our departments that are positive. So we are actually changing our staffing model to reflect this new influx. And what will result is we're going to start reporting out higher numbers for the next few weeks, maybe double or triple what we're seeing now. Now, that is countywide. That isn't specifically focused on Eastern Kern, where the numbers are low. The governor, though, based on the counties throughout the state, has, as we're all aware, has implemented some further restrictions. They like to call this the dimmer switch. What they've done, and I'm sure everybody's aware, they asked for counties that are failing the state metrics. In other words, if our number of cases is higher than they would like, then they've asked those counties, and it was about 80% of the population of California was affected by this. They closed down bars and prohibited in-room, in-dining, eating. That was the first step, and that occurred. Now, this last week, and this is what Supervisor Gleason is referring to, they implemented the next set of closures, and it was initially targeted for those counties that had failed additional metrics. Kern was identified as one of those counties, and we were surprised. The governor announced Kern County failed the metrics, and we needed to further shut down businesses. And that is, I know a lot of you have seen that, but personal care, hair salons, movie theaters, the list was extensive. They then called and said, oops, we made a mistake. You're not on the list. We messed up. And so we don't have to close down those businesses. Now, they're actively watching our numbers every day, and we believe that we will likely fail those metrics in the next coming days because we can kind of project out. And the governor's new order on those businesses that must shut down would actually, we project, might take place next week. But we're going to wait for the governor to tell us when it applies because we don't know day to day. You have to fail the metrics for 3 days in a row, and then they give you a 3-day grace period, and then it applies. As Supervisor Gleason said, it's really hard for a business to then plan, staff, order resources if they don't even know when they're going to be open and closed. That is presenting some significant consternation on our businesses on how to run a business. We recognize, and Supervisor Gleason, and I know, Mayor, you said this, there is interest in trying to parse out portions of the county. And Eastern Kern, your numbers are far less than Bakersfield proper. And I understand why you're asking, and I agree. I also appreciate the concept that we have to be careful what we're asking for. I think it's certainly worth a chance. Supervisor Gleason has tasked me with starting this conversation and figuring out how to do it. I will tell you there's no model. They have not allowed this to occur in any other county in California. There are other Californias like Kern that are kind of segregated geographically. They have kept counties together. That doesn't mean we can't ask and we can't advocate, and I appreciate your interest in writing a letter. We will try, but we have an uphill battle ahead of us. Supervisor Gleason, did I miss anything you wanted me to cover?
I think you're spot on, Matt. Appreciate it, but I appreciate also if we open it up, the mayor might have some questions for you, and maybe we can hang around and answer some questions. Thank you, Matt. Appreciate it.
We really
Back
would
to you, Mayor.
appreciate it if you would stay on so we can ask and the public can ask also. I know that one of our concerns is that what we ask for may not be exactly what we want and what we get. And therefore, that's why I wanted us to do it not as just one city, but as, because there's so many in your first district, Mick, that have no cases. No, there's some that have no cases. And I thought our letter to the governor would be much more effective if it came from the hospital, from the city of Ridgecrest, from the county of Kern. However, knowing that that can come back and hurt us, I want us to explore it a lot more fully before we go back. Now, that doesn't mean I want to spend weeks and weeks and weeks. I would like people smarter than I am to look at that and say, can we make this happen? Should we make this happen? And what happens if we ask the governor to do it and he says, okay, you got it. It's your problem. You are going to shut it down and you're going to open it up and you're going to enforce it based on whatever. And regional variances can be applied in many, many other areas. And I want to make sure we don't ask for something that hurts us. So, Matt, have you talked to I know I was told last week that you had talked to the governor's office and they said basically no, but heck no. Where are they at all in listening to us, or are they listening at all?
Mayor, they are not listening, they're telling. There is not much of a chance for feedback to their orders, to what they're doing. They tell us. So we're having to sort of reinvent how we come back at them to say, hey, we want to relook at how you apply these regional type of approaches to the state. There's not a process. So we've had some general conversations. It has been a little while. So Supervisor Gleason asked that I go at that again and take another shot at trying to get some answers and you know, kind of pitch the concept. Eventually, if there's interest, we're going to have to figure out how to define boundaries and how they would approach this. I'm concerned that the potential is limited, but that's not going to stop me from asking and trying the best I can.
Council, the only other question I'd like to address after, I'm sure others will have this, what do we tell our businesses that have to order supplies that say, okay, I'm going to be open, I'll order all my produce and my meat in, and then you turn around and find out you can't, or you can only do it outside, and it's only 114 degrees out here, and there's not a lot of people that want to sit out in 114-degree weather and say, oh, let's have a lot of food. So think about how we can address that, if you would, and I'm going to ask the council and then the public. Council, any questions from any of you? Go ahead.
Yes, this is a question for Director Constantine. This is Councilman Heyman. On the numbers, when it comes to the increase of 4 times more testing, do we know the ratio of how many more positive cases there are and how that relates to the ratio of increased hospitalizations or deaths? Is that increasing at a 4-time increased rate, or is there a lowering of that ratio as a whole? And because I know that the numbers will increase with the testing, but I sure would like to see how that parlays over into increases in the actual positive cases and the hospitalizations or deaths. I hope that's clear.
It is very clear, and you speak like an epidemiologist, council member, so that is the question. So we're not seeing the overall positivity rate, meaning the number of positive.
Go ahead, please.
The number of positive tests, okay, it is not changing. So that varies usually around 7 to 8 to maybe 10% at the most. The hospitalization rate remains pretty consistent. It's about 10%. The ICU rate remains 3%. So we're not seeing changes in higher increased positivity rates or hospitalization rates.
Any other questions or follow-up?
ICU probably include it. No, that answers the question pretty clearly, and that seems like pretty powerful information to maybe, use, and I'm sure you are, to, get maybe something done with on the governor's side. But anyway, thank you very much.
Anybody, other council members?
Yeah, more of a comment, really, and it's just more of agree with what we're doing here on the council and what everybody's working towards, is that we heard from Mr. Fong just was it yesterday, I believe, in a luncheon, and he brought up a very good point that it's not necessarily accurate to compare opening up businesses to not caring about lives, because if we look at the way hospitals are taking the hit, losing good doctors, nurses, I mean, their revenue is being lost at an alarming rate. So it is equally as alarming to say, when you go to the hospital, you may not get the care that you think you're going to get. You may not have the doctors you think you're going to get. So it's a concern, and something I thought I'd add after hearing Mr. Fong speak. It was a good conversation. So I think that us working towards this makes sense, and I would imagine there are other counties, such as LA County. I mean, it has to be different between downtown LA and Lancaster, Palmdale. So I'm hoping, since the governor did state he was going to do everything he could to be as data-driven and science-driven as he could, maybe this is one of those cases. And it would also make sense to me that should our numbers go up, that Kern Department of Health would shut us down just as quick as the governor's office would, if that makes sense.
Okay. That was Councilman Blade, sorry.
This is Councilman Maurer. The concern I have about being separate is 6 weeks ago we had 12 confirmed cases. Monday we had 61, today we have 69. And I assume that the hotels have gone up. They look a little fuller than they used to be. And as people start coming into town, number one, to work on our roads, number one, to work on the base, several of these cases have come from out of town. And the more travel we get into town, I think the more positive cases we're going to get. And I'm worried if we get an uptick and we're separate, that may come back to bite us.
That clearly is an issue. Yeah. Do either of you have anything you'd like to say on that?
Go ahead, Matt.
Well, I think you're wise to think this through. I think there is some risk. Now, your numbers have historically remained low. The state likes to look at it, though, as per capita, right, and not the actual number, but the per capita rate. and we would, they would like to compare that. I do want to clarify that locally, we're not issuing any sort of orders. We're not telling people to shut down businesses. The governor is in charge. It's the governor's order that then is applied here locally. He is the one that is dictating this. It's also kind of relevant to recognize that, for example, for bars and restaurants, those restrictions originally applied just for some of the counties. Last week, the governor applied it statewide. So regardless of your numbers, regardless of where you live, bars have to remain shut and restaurants can't have in dining room eating. So they didn't even care about numbers elsewhere. We think that this current set of closures that involves gyms and churches and workplaces and personal care and barbershops and hair salons will follow a similar pattern, applying initially to those counties that are failing the metrics, but then potentially expanding statewide also.
Okay, thank you. Is there any other council comments?
Well, I just have one quick comment in regards to the increased case, in regards to the increased cases in town. So if you look at the population base and divide this in, it still comes out to 0.00246. When I did this last council meeting and we had lower numbers, it really didn't lift this number hardly at all. I hate to sound like an epidemiologist again, Matt, but anyway, so I just want to, I put that out there because it, to me, it gives you comfort, at least in this region of the county, that our numbers are percentage-wise very, very low. Anyways, thank you.
Okay, thank you. Any other council comments?
Yes,
Go ahead.
sorry. Something that a lot
Please
of people...
identify yourself.
Oh, sorry. Lindsay Stevens. I was asking, a lot of people keep commenting online, asking the county dashboard is different than what the hospital numbers are putting out. And yesterday on the call, Assemblyman Fong explained that you all are verifying. Can you explain what that means when they say that yours are verified but the hospitals aren't, and why there's a difference there?
You're verifying that the hospital's
absolutely.
numbers aren't right?
No. What Assemblyman Fong said yesterday was that the numbers that are provided on the dashboard for the county have been verified.
Okay, thank you.
And that's what I wanted to know. Is
understand.
that why there's such a discrepancy? Because it takes them time to go through and verify the positives that the hospital has. And why are those different?
Sorry, I interrupted. Go ahead, please.
No problem. I appreciate the question because I know that's of local interest. And Jim Suver and I talk often about this. We were just on a call, actually. So the numbers that you see that are on the Ridgecrest site do include areas outside of Kern. It lists Trona and other service areas, so that might account for some of it. Since Ridgecrest is one of our county-sponsored testing sites, the hospital gets the results really fast, and they get them first, and then eventually they get reported to us, and then they go into a state system, and then we access that state system, and then we actually have a process that's called deduplication. For example, if Supervisor Gleason was tested several different times, we don't want to count him several times, so we have to deduplicate the person. We then actually verify that that person being tested resides within Kern County. That demographic information is sometimes either missing or incorrect, so we ensure its accuracy. And I'm sure Ridgecrest does the same, because the hospital, because they know. And as I mentioned earlier in the call, we are getting a tremendous amount of lab reports that just all of a sudden hit hard, and so we are behind. And so with our increased staffing now, we're going to address that backlog. And we actually, the Ridgecrest Hospital gave us a list of every person that they're putting on their website, so we're actually reconciling the list to try to ensure we have similar numbers So those are all kind of the explanations on why the numbers don't match perfectly. And this is inherent. We're all interested in real-time data, and it's a pretty complicated system. We have to use that state database, and Ridgecrest doesn't. So that's kind of some of the explanations. We're hopeful that they'll match soon.
Okay. And then
Well, and they're never going to totally match. If you know on the Ridgecrest site, the Kern County site has it broken down by area code.
Zip code.
Zip code. And the hospital now has it broken down by Ridgecrest, Inyokern, Trona, and other. So our total numbers are not going to be reflected in the 93555 code. They're going to be reflected. First of all, Trona is out of the county, so they're not even going to show on the county site. Inyokern is separate, and other areas separate. So they're giving us more information now than they were, which really breaks it down to where we can get a better grip of where they are.
Then I had one more question. So I saw that our hospital has announced that the free testing program is going away. Is that something that's happening across the county? And you're saying the last several weeks you've seen a significant up 4 times the amount of testing. When the free testing goes away, are we expecting a drop then? And then how are we going to make sure that we're maintaining the testing requirements that we're supposed to see if the free tests go away?
Another very tuned in question. So thank you for that. The testing labs have indicated some significant shortages with reagents that they use in the labs because of this giant upswing in testing, and also the actual swabs and the transport medium that they put the Q-tip in. So because of those shortages, statewide, and it's probably nationwide, the state yesterday, California Department of Public Health, came out with a new prioritization for testing, where they're suggesting that we prioritize symptomatic individuals first, and first responders and essential workers second, and way down on the list are non-symptomatic or asymptomatic individuals. That is designed to preserve the limited number of tests that we see in circulation. So Ridgecrest, Jim Suver got on it right away and recognized that they need to preserve some of those testing supplies for those that are most sick in the hospital. So on his own, he's decided to basically implement that prioritization schedule so that we can make sure that those that are really sick in the hospital, we can test. But you're right, the result of that will mean we have less tests, and those that do get tested are going to be more likely positive. So our positivity rate increases. Our hope is that that is a short-term supply issue that will be rectified in the near future. But we are probably going to see all of our 10 testing sites follow suit and also start limiting. It hasn't happened yet, but that is a concern. So that will affect the numbers.
Okay, is there any public who would like to address or speak to them? Oh, okay, let's take the one online first. Please identify yourself. Person, whoever's online, please identify yourself.
Madam Mayor, Scott Miller here. I apologize, I haven't been able to hear for the last 13 minutes, so this may be repeating information. For the health department, gentlemen, at the beginning of the call, you said there weren't boundaries made for COVID. However, on the website, your boundaries are already designed. You had east, west, central, mountain, and desert. Aren't those areas already predefined by the health department?
Mr. Constantine, were you able to hear that?
Yes, ma'am. So I think I understand the question. Early on our map, we used a arbitrary sort of geographic distribution that we generally used for valley fever, where we drew lines to distinguish 5 geographic areas in the county. That we've since replaced, and now we use zip codes, as has been mentioned. But the state doesn't recognize anything less currently than a county boundary.
Okay, I can understand that. However, and that makes sense. However, if we're going to have a discussion with the powers that be, that may be a road less traveled. Although they may not recognize it, it may make most sense to them using what I guess you said you used it for valley fever, using that for COVID-19, using the same metrics as the desert region and the mountain region. The numbers are going to be about the same, using the same geographic numbers that we started with, rather than moving to the new system. I'm thinking from an argument standpoint with the powers that be in Sacramento, that may be a road less traveled, that they may say, oh, that makes sense. If you already covered all this, I do apologize, but that's what went through my head. And I am aware of the new site, and you can tap on it by zip code. And like Madam Mayor said, Mr. Gleason's areas, some of them have little to none, and Ridgecrest has very few. So using the same geographic marker set up for valley fever could prove to be beneficial. That's all I have. Thank you for taking my call.
All right, thank you, sir. All right, public comment. Would you like to come up and speak? And did you want to add anything to that, Mr. Gleason or Mr. Constantine?
No, ma'am.
Okay, thank you.
This is Matt. I think his points are well taken, and I agree.
Thank you. Okay.
Hey, Mick, this is Dave Atkins. Am I on?
Yes.
Hi, Dave.
Hi. I don't know why people make such a complicated mess out of a simple thing. I have been following this ever since the March shutdown. I go online to the China Lake Naval Weapons Station weather station report. They have added the COVID information as part of their daily forecast. Now, it doesn't change every day, but it does change periodically. And as of a few hours ago, before I came down here, I double-checked to see what it was. The number, this is Kern County now. This is not the east side. This is the whole Kern County. The number of deaths listed is 98. The number of confirmed cases, which I assume is accurate, is 6,000, where is it here? 6,979. All right, if you take the number of deaths and divide it by the number of confirmed cases and multiply it by 100%, that comes out to be 1.4% of the confirmed cases. Now that number, by the way, has been going down. It was earlier in the period here that I mentioned 1.8%. Now if you take the 98 deaths and take the population of the whole county, which I have been using an estimate, and I grant you it's an estimate, of 88,000, 88,000, okay? 888,000. I get a number right yet. And divide that, divide the number of deaths by that, it's 0.000 some percent. It's negligible. So that's the number we should be looking at, and the government should be looking at. I don't know where in the hell they're getting some of these other numbers. They don't make sense. And Matt, you said something earlier, and you were very accurate. You said the governor is dictating. And I emphasize the word dictating what we should do. And I think that's exactly what he wants to do. He actually doesn't, in my mind, and I thought I would like to see some legal opinion from the county council or somebody as to whether or not he really has the power to do this. I don't think he does. And neither do any of the other states, or the federal government, or the CDC. Our laws are made by the legislature, not the executive and not the courts. Do you hear what I'm saying? We need to fight back. We need to push. We are adults. And for Matt's information, Mick, you probably know this, I'm 89 years old. I'm also in the high risk, what they call the high risk. I take 2 inhalers, I have nasal sprays, I have a pacemaker, and I can name a couple of other things, but that's enough for now, I think. And I didn't get here by being stupid. We know how to take care of ourselves, and we need to quit being the fall guys for the nanny state. Now, if you want to dispute my numbers, you can call me later. But I think that they speak for themselves. And this is the whole Kern County.
Okay, let's give him an opportunity to answer some of your questions.
Well,
Mr. Matthews, if that's okay with you.
sure, go ahead.
Thank you. Sir, gentlemen, do you have anything you'd like to add or say?
Just before you do that, I'd like to
I'm
add
sorry.
one other thing.
All right.
There's a lot we don't know about this virus. We're assuming, like some of the medications that I take, do they help in alleviating some of the virus problems? Nobody knows because nobody's done any testing. Thank you.
Okay, thank you, sir. Gentlemen?
Let me jump on that one, Matt, if you don't mind. Dave, thank you very much for your strong comments. Your fierce American spirit, I hear it loud and clear. I just want to make one comment, Dave. You said you were 89 years old, and personally, I don't think you look a day over 90. So,
Thanks a lot.
But I do want to say this. I want to say this, Dave, because I lean in your direction on this issue. My opinion and what I convey in my conversations with Jim and with everybody I talk to is I think it's important that we open. I think it's important we open as quickly as we can. And what I mean by that is that we open ourselves for businesses, but we do it responsibly. And the responsible thing for me is to ensure that our medical capabilities are always there, capable of managing the problem. And the problem in my mind is ICU beds and ICU staffing. Provided that metric is managed, and we manage that metric, not positive cases, not negative cases, not deaths. I think we manage to ICU beds, ICU staffing, and as long as we as a community can ensure that we can provide adequate health care to those of us in need, I say that's the point to which we open. So I don't like the way the state of California is managing this. I don't like the directives that they're coming down with. I don't like the way it's being presented. I think our economy has been blindsided by a machine that is not necessarily experienced in managing this type of stuff, and I think they have made some mistakes. And I would like to advance Peggy's thoughts, the mayor's thoughts, as much as I can, and advance and merge them with Jim Suber's thoughts, who's primarily concerned with his medical capability of providing, his medical service to our community. So I agree with you. I respect your independence and your passion tremendously, and I lean in your direction, provided we can always provide that medical care for those of us most in need. So that's what I think. And thank you, Mayor, for allowing me to speak.
No, we want you to speak. Thank you. Okay, was there any other
Thank
public
you.
comment?
I'd just like to thank Mick. I agree. There's one other thing I forgot to mention. Who determines what is essential? To me, a pedicure is essential because I can't bend over to do that myself. And if I don't get a pedicure regularly, I get ingrown toenails and other things, and I probably won't be able to get them treated at the hospital because they got some stupid regulations put on by the bar for this virus stuff.
Okay, we'll get an answer for you, Dave. Okay. Do any of you want to say who determines what essential is?
Mayor, this is Matt. So the state has a list of what is defined as essential businesses and essential workplaces. This was the list that we used in early March that was mentioned earlier in this discussion. And now that the governor is suggesting that non-essential businesses should shut down, we are going to revert back to their established list to make those decisions.
Okay, thank you, sir. Other public comment, please.
Yes, Mike Neal. Just like to note I'm wearing my mask when not speaking out of respect for Mr. Blades and Ms. Stevens, who see the need to do so. And I do that in businesses where I go in and they ask me to wear my mask. It's their business, and so I respect that. Not that I think there's that much need for a mask in most cases. I took a trip in early June back to some of the hot spots, and I came back just fine. Not a big deal. And everybody's all clamped down, and everybody's wearing masks and outside and so forth and so on. Now, part of the problem with this whole virus thing is the propagation of something called mysophobia, which is basically germophobia. Fear, everybody's afraid. Everybody's, oh, I'm going to die. I'm going to get the virus. And yet, we've been in this 4 months now. We know that there's a small percentage of the population that potentially could end up dying when they get the virus. Everybody else is going to get sick for a few days, just like with any other flu, and then they're going to get over it, and they're going to go back to their life, and then they're going to have immunity. Now, I haven't heard one single sentence of discussion about herd immunity, and, if there's any attempted ways of taking a guess as to how far along we are with that, because once the whole population gets a herd immunity, this thing's done with. Now, I understand, of course, the case fatality rate worries, the ICU capacity worries, but what I heard tonight, unless I missed something, our hospital is not full. We don't have all our ICU beds even close to full. I don't know what the exact numbers are, and it's not increasing.
You'll hear that in a little bit's report.
Good.
You haven't heard it yet.
If that's dangerously increasing, then maybe we have a problem because, we know all this. We've heard all this 10,000 times. If you turn on the news, you'll hear it at least 8 times, throughout the evening. Well, you're in a world of hurt if all your ICU beds get full and everybody's sick and laying in there dying on ventilators, and you're putting them out in the hallway and you're doubling up your beds and so forth and so on. But that's not where we're at, and I don't believe we're ever going to get there in Ridgecrest because we jumped on this thing early on. People were wearing masks. Stores were limiting attendance or, their customer counts, the whole 9 yards. And we're still doing it for the most part. And obviously it's been around and we're starting to get our herd immunity developed. Now, the problem with worrying about just the numbers is this. They're just looking at virus case numbers. And this is for you, Mr. Constantine. What about the rest of the effects of this whole situation, either directly or indirectly, but you can attribute with some logic effects from the virus and from the isolation of the virus and from the trauma of businesses closing down. It's called governing with wisdom. Just looking at numbers is an engineering approach that's sometimes good, but even when I was an engineer, I didn't just look at numbers, especially in cases where there were non-numerical beings involved like human beings. Why aren't we talking to our police and asking them, what are you seeing going on? Are you seeing increase in domestic violence? Are you seeing increase in crime? Are you seeing increase in kind of things that we know can be related to the effects of all this that's going on? That should be part of the equation. The other part of the equation should be, how much are you going to factor in having all these businesses be closed permanently? Oh, you tell them, oh, you're good. 3 days later, say, no, you're not good. You got to shut down. Ms. Breeden, you understand this. Everybody else understands this. You don't even have to have ever been in business to understand this. You can't function that way. And if you're going to let the state tell you all this, give you all this direction, arbitrary direction, I think it's pretty clear, you don't agree with how they're determining what they're doing and what they're doing, and you need to look after your people. Now, this is for Mr. Gleason. I don't know if you've ever heard the term intervention, but at the county level, we need some intervention between us and the state. We need to have some backbone being exercised here and some common sense, like I've already talked about, in the decisions that are being made, and tell the governor, look, this is bad for our people. We're not just going to jump to when you all of a sudden arbitrarily statewide say, close this, close that, close everything else. It's going to continue for 30 seconds.
Please make it 30 seconds, because it's not fair if I let somebody else not do
I'll
that.
beat you to 30 seconds. That's what you need to do. You've got people here adversely affected in all kinds of ways, and the effect of that is going to go way past the effect of some people getting the flu and feeling bad for 5 or 6 days, which is the vast majority of the cases.
Okay, Mike.
So exercise
Thank you.
wisdom in what you're doing here, gentlemen.
Thank you, Mike. All right, comment, gentlemen?
Not me.
Matt?
So this is Matt. Just to kind of, I understand the public speaker's comments, and I take that to heart. A couple comments. The first is, I recognize that the state's action has non-health related impacts, economic impacts, social impacts. Unfortunately, it's not Kern County that is making these decisions. The state's in control. The state's issuing the order. We have limited or no ability to augment that approach. Which has been mentioned now twice, though, is the ICU cases. And, the limiting factor that we have in Kern County is the models show that our ICU cases will exceed our capacity by a factor of 4, in fact. And that's what drives a lot of our concern. So the models that the state has provided shows that by July 28th, we will exceed our local ICU capacity. And that means our 10 acute care hospitals, including Ridgecrest Regional, would exceed, the demand would exceed their capacity on July 28th. And right now it's at 78 beds. We asked the hospital CEOs to pull together and to find every possible way to change beds from a regular bed to an ICU bed. And that means putting an ICU bed in a janitor's closet, putting it in a hallway. What could you do? And they actually increased their ICU capacity, bed capacity, in a surge to 294. Now that was really helpful, but the model shows that on November 13th, we would actually exceed even that surge ICU capacity. And we show a peak on February 5th of 436 beds that would be needed, and we only have 294 surge beds available. So the ICU beds is the driving factor in all of this, and what goes along with a physical bed is a nurse, an ICU nurse, which is just invaluable. And Supervisor Gleason and his colleagues are working on a plan, in fact, that would allow us to help increase the ICU nurses countywide, and we're looking at bringing that forward for Supervisor Gleason's consideration on July 28th, in fact, to use some federal dollars to help hire some traveling nurses to increase that number. So that kind of provides a little bit of perspective, but I understand the comments from the public speaker, and I take those to heart.
Okay.
Mr. Constantine, this is Kyle Blades. The state model that you're using of a metric, how accurate has that been to date in prediction?
So the state model, it's early on, and we are tracking pretty closely to what was been predicted. We are only a couple months into the state releasing this model, and it has obviously a lot more to project out, but we are tracking pretty closely to what was expected even at this early stage.
Thank you.
Okay, is there any other public comment?
I want to ask a clarification. Matt, this is Councilman Maurer. You indicated that the model shows that by the end of July we're going to be over capacity. What percentage of capacity are we at right now?
I can't quickly do the math for you. We have 78 ICU beds available today. That is really good. And we, in fact, have almost 900 hospital beds available between all 10 acute care hospitals. That number is fantastic. And the state actually tracks that carefully, and we far exceed the state's minimum standard on ICU and bed availability. It's just our pending cases may push us past that.
Well, let me clarify that then. I don't need a percentage, but how many of the ICU beds are occupied right now?
If you give me just a second, I can tell you a number. It might take me about 60 seconds.
Those who may be calling in, this appears to be close to the end, so if you have anything you want to call in about, please do so. I'll give you about 20, 30 seconds. Is there any other public comment while we're waiting for Matt to get us the answers?
I have another general question, if you guys don't mind.
Okay.
It's for Mick and Mr. Constantine. That really is what I stated earlier, that Assemblyman Fong stated, that we're seeing the issues with hospitals, revenue, losing people. Is that an issue you're seeing countywide, Mr. Gleason? And I know it was an issue we're having here. Budget shortfall, economics could then equal into healthcare shortfall. So is that something that you see countywide, sir?
Yes, that is a major concern across the county. The fact that we've had non-elective surgeries canceled and then had elective surgeries, and doctors have been laid off, and nurses are being more and more, as first responders exposed to greater threats and stress, and it's the condition of the economic situation of our hospitals is of a concern to all of us, and we're all focused on ensuring that our doctors and our hospitals are taken care of as best we can. I don't know how to answer your question, Kyle, other than to say yes to both. It's a concern for all of us.
No, that's a perfect answer. I just want to keep foot stomping that point, so we don't lose sight of the fact that we're all interconnected here, not just community, county, state, and we need to keep that in mind. This isn't as simple as closing doors and expecting things to go away.
Yes, sir. I understand. We do discuss that. Thanks.
The problem I have with models, that's why I asked Matt the percentage, or the number actually in ICU rather than what the model says, is the models in the past have all been wrong. And I'm going to be a little facetious here, but if my business is shut down and I go bankrupt, so I commit suicide, that's a COVID-19 death.
Let's hope not.
Well,
Okay. I know, you're being
I'm just
facetious.
being facetious.
Okay, Matt, would you have that number yet?
Yes, ma'am. So I show that the state is reporting that there are 62 ICU COVID positive patients in Kern.
Okay, thank you. All right, I see no more. Oh, I see one. Okay. Caller, please identify yourself. This will be the last phone call. Caller? Caller, please identify yourself. This will be the last call.
Okay, hi, this is Jessica Weston from the Daily Independent. I had a question, and I apologize if you guys covered this because I left the room for a minute. But Mayor Pro Tem Stevens has posted a letter that she's sending to the governor asking that Kern be considered in a different light. I was wondering when Mayor Breeden was talking about the council sending a similar letter, if you guys would all just sign that one, or if you're thinking of a new one, or what exactly is going on.
I would like to see what's going on as we continue to look at this, briefly get some answers, and respond as a group if we decide this is what's best for all of us. I think everybody responding individually is just one more. I would think a team effort is where we need to be, and I'd like to see that done and make some analysis of what the directions are from the county, the hospital, the city, as we work together.
Okay, I have another quick question. Did Mr. Constantine just say that the state is reporting that Kern County has 60-something? What did he just say?
Yes, ma'am. The state is reporting that there are 62 ICU patients in Kern County.
Okay. Is there a number for Ridgecrest or a smaller physical geographical location, or do they just break it down by county?
We're going to get those in just a minute.
Just by count.
Okay, all right. Thank you very much.
Matt, I didn't mean to interrupt you unless you had later ones, and I know that Jim has given Ron.
No, ma'am. I just have the county number.
Okay. All right, I'm going to go to Ron now and let him give his report. And if you gentlemen want to stay in line, please do so. If you don't, I want to say pardon me?
Yeah, Madam Mayor, sorry to interrupt you. I just want to ask a question before Ron did his report. Quick question, Mr. Constantine. You stated there's going to be an increase in October. Would you mind explaining that real quick?
Yes, sir. So the model shows, the model right now shows that we're going to reach our peak ICU bed demand in February of 2021. Was that your question, sir?
No, I thought I heard you said October, but no, okay, that's good. I just want to understand what was the catalyst.
Okay. All right.
Right. So the model shows that we. All right. Go ahead.
No, finish it, please, Matt.
The model shows that we exceed our normal ICU capacity on July 28th of 78 remaining beds, and an expected surge capacity on November 13th of 294 beds, and a peak on February 5th demand of needing 436 beds.
Okay, thank you, sir.
Okay, gentlemen, thank you. You're more than welcome to stay on and listen to Ron's report. So, Ron, would you?
Yeah, Madam Mayor, members of City Council, yeah, I think that most of what I was going to report on was covered by Mr. Constantine and Supervisor Gleason. But I do want to give you an update on the CARES grant and where we're at on some of our projects. We are ready to move forward on our sneeze guard project, which will provide sneeze guards at the finance department, city clerk desk, building department, animal control, as well as Parks and Rec department. We're also looking to move forward on our one of our touchless features project, which is making all of our faucets and toilet features hands-free in an attempt to keep the spread of the virus. We also have an automatic door project that we're going to move forward. We have doors that we're looking at replacing at the animal shelter, at the Kerr-McGee building, doors over there by the daycare facility, as well as the police department, and all that's in an effort to keep our sanitation in line, to keep the spread. These are projects that are in line with the Kern County grant, as well as our Cal OSHA guidelines for offices, and encouraging as many touchless areas as we possibly can within our buildings to protect the public and staff. We're also looking to move forward on our council chamber project. We do believe that we'll have our final numbers in this Friday, and we plan to move forward on that. We did speak with our representative at Kern County regarding these projects, and they stated that they were within the guidelines. So we are going to move forward on these because some of these are items that we need to do to begin to open up our building.
Okay, thank you. Matt and Mick, thank you very much. I know you both went above and beyond, and we appreciate the honesty and the openness and willingness to tell us where we are and what you think it's going to be in the future. Let's hope it isn't as bad, but we need to prepare if it is. So I say thank you very much.
Thank you, Mayor, and thank you, Matt, for participating and coming to my rescue. Appreciate it. Mayor, our pleasure, and I'm signing off.
Ron?
Okay, thank you. Lloyd, can I ask you a question that was asked earlier? Are you on where you can speak, Lloyd?
I'm on, and I hear you.
Thank you. There was a question asked, did the governor have the authority to do that, what he did, closing, opening, closing, whatever, making those rules, because the allegation was that he did not have the authority, and I've seen some court cases that said he did. What do you know, please?
You bet. Thank you, Madam Mayor. Lloyd Pilchin, City Attorney. So I have not extensively researched the cases, but I can tell you that from talking to all of my colleagues and other city attorneys, that the law is gives broad emergency powers to a state governor. So I have not seen a compelling, good argument that the governor is clearly acting outside of the law. I have not seen anyone make a good legal argument on that. If you'd like a more thorough analysis of this, I'd be happy to prepare it for you, but I can tell you that as a general rule, emergency situations give governors broad authority. They have to be able to act quickly, and they're given the power to do that.
I don't think anybody wants you to spend a lot of time researching that unless council directs differently. But from all I've seen what you said. So, council want to?
Yeah, I think that there was a group of churches that got together and sued him and they lost.
Yes, that's
So
the one I heard.
But the courts have varied by state. Some states, the courts have ruled the governor was out of line. California, the courts have ruled he has the authority.
Okay, thank you. All right, since there's no other comment on this item.
I did have one. Sorry.
All right.
You had mentioned earlier that he was going to give updated numbers for our individual hospital. Did you have those numbers for the ICUs? Because that was a question that someone had asked.
I do not believe we have anyone in ICU, Jim did say that we did have some inpatients, not a lot. Currently, we have 62 positive tests within our community, which is up by 32 from 2 weeks ago. According to the hospital numbers, there's 47 positives in Ridgecrest, 3 in Indian Kern, and 11 in Trona. And we currently have 635 pending tests, which is one of the reasons why we're looking at slowing down the voluntary or the free testing for a period of time. Obviously, I believe that robust testing is a way of keeping our community open, at least in a couple ways. One, it allows people to have a peace of mind, and two, if people are positive, we learn about it sooner than later, and we're able to have folks that are associated be able to self-quarantine to be able to control the virus from spreading unabated within our community. So I'm hoping that once the supply issue is resolved, we can get back to that.
Are they keeping track of the recovered? Like that was something that Kern County lists how many positives they've had and then how many are recovered.
It's not, I don't believe, from looking at their site, it's not covered on the Ridgecrest Regional Hospital site, but it is documented on the Kern County Public Health site.
Okay.
Okay. Is it going to be very long, sir? Please come up and do it then. Lloyd, can you hear him?
I cannot.
Okay.
All right, this is Dave Matthews. You said this governor has wide-ranging authorities under emergency situations. Are you telling me that 4 months is an emergency? I don't think so. This has gone on too long.
Okay.
And
Dave.
also the church cases, that's not over yet.
Okay, Dave. Thank you.
Just to comment, the Spanish flu in 1918 went on for 2 years.
Thank you. Were you there?
Yes.
Oh, sorry. Okay. All right. We are done with this item, and we will go on to the next item. That is a discussion and provide guidance to the city's representative on the board of the Indian Wells Valley Groundwater Authority. Sir.
All right. So we did meet last month, and we had a pretty full schedule. I can kind of do just a rundown off the agenda, or if anyone has any specific questions right off the bat, we can go that route if you prefer one way or the other. Okay. So item 7 on the board, it was board consideration and approval of litigation of the tolling agreements. We agreed to move forward with that. Item 8 was board consideration and adoption of resolution 05-20 establishing a reporting policy for all new groundwater extraction wells in the basin. We moved forward to move that to PAC and TAC for further review and analysis. Item 9, board consideration and introduction of ordinance 02-20 and supporting data package amending ordinances 02-18 to provide for a needed increase in the current groundwater extraction fee due to increased studies and litigation costs. The board agreed to move forward on the increasing the extraction fee. So that fee has tentatively been looked at $218. And so last time we had reviewed the cost of that down to the ratepayer, and I think it'd come out to $3 or $4. But so they're looking at extending it out over an even longer period of 18 months instead of the 1 year, which would bring that fee even less than that. So I don't have the exact, dollar amount, but, based on the ratio, I guess if you, took it 1 year versus 18 months, 40, 50% maybe decrease in that number. So, which from the city's perspective, myself, that the lower that fee is on the ratepayer, the better. So I think it's, I think that's a good move. So item 10, board consideration and preliminary adoption of report on the Indian Wells Valley groundwater basin sustainability yield of 7,650 acre feet and setting a hearing on same for July board meeting. We voted to move forward with that. Item 11, board consideration and adoption of engineer's report for the adoption of a basin replenishment fee, authorizing the mailing of notices on the same and setting hearing for August board meeting. That was agreed to move forward on, but it, with the stipulation of further review and fine tuning of, the fee, the time, and so that will be addressed, I believe, at the next meeting tomorrow. Item 12, board consideration and preliminary adoption of a report on transient pool and following program and setting hearing on the same for July board meeting. There's agreement to move forward with that, and that was basically the main items that we.
Any questions or comments
Yeah,
from the council?
The one mentioning the meeting, is that the mailer where everybody got?
The Prop 218, yes.
that doesn't indicate what it's going to cost us, though, does it? I've had a lot of people ask me, and there's nowhere on there
That
you
shows
can say
the
it's going to cost you
fine-tuning of
$10 a
that
month
fee.
or $100 a month. Or,
I think that will be, once they have, after the next meeting, that's finalized, the 18 months and the completing of the numbers. So I think after tomorrow's meeting, we should have an exact amount on that.
That's
But-
not till August.
So I thought
Yeah.
the 18-month was about the pumping fee.
That is the extraction fee, not the
The replenishment fee is what he's asking about, the 218. And basically, they won't know how that's distributed until the water district decides and after it's passed, correct?
On the replenishment fee?
Yes.
I think that was moved forward with the idea that there would be a fine tuning of those numbers of the replenishment fee. Yeah, so I don't think that's been a firm setting of any.
Are they fine tuning before or after they pass it?
What's that?
Are they fine tuning it before or after
Nothing's
they
been
pass it?
passed yet.
No, I know, but if tomorrow tomorrow it says you're supposed to vote on the pumping fee, is it getting fine tuned and voted on tomorrow?
Correct.
Okay, that seems a little rushed because no one knows exactly what it's going to go. And so then I had questions because from the water district meeting, who's getting the definition of who's getting charged the pumping fee is changing, and who's getting charged the pumping fee once it's adopted.
The replenishment fee,
No, the pumping fee, the one tomorrow.
the one, so you're talking about the increasing the pumping fee
Right.
from $30 to,
It was 225, but now you're saying 218,
Right.
and it might go down more. But from my understanding is who's getting charged that fee is also going to change.
I can't answer that.
Okay,
I
because
think-
that's one of my questions, because my understanding was that the farmers may not be getting charged that pumping fee with the increase, or did it depend on the transient pool and the fallowing program, which neither one of those has been set up, and so there's some confusion there. And then the other question I had on both fees is, it seems concerning to me that we're seeing a fee go from $35, nearly a $200 increase. And so on that fee, the fact that there is no cap on how high that fee could go, and there's no cap put in place on how long it goes. So, so that same concern applies for the replenishment fee, and I would like to make sure that in the replenishment fee, that 218 hearing, because on that thing, it did not provide for a cap or saying if there could be an increase, and it didn't provide for a sunset. It said maybe 5 years, but it could extend it didn't say it ends in 5 years. It says it might be 5 years, it could be longer. And so those were concerns to me, because seeing a $35 fee jump to 200 and something, and then potentially this other fee, which we know on the water district customers is going to be $4 million. If it increases even more, that's just a lot of potential variability. And then the pumping fee, from what I read, is including litigation costs. So if we see, which the rumor is that we're going to see lots of people starting to litigate this matter, is the pumping fee really going to end then? Or because we're going to see litigation costs continue for who knows how long, that then the pumping fee continues for a long time and the replenishment fee continues, and then eventually we'll finally have the project fee. So it's just a lot of fees, and it sounds like there's a lot of fine-tuning left to be done, and so it concerns me.
Let him answer some of them before, because I'm having trouble keeping track of all the questions.
I think I'm
Lindsay.
following, so let's break it down to the pumping fee increase.
The
So
one tomorrow.
Pumping fee,
Yes.
we discussed last city council meeting, and the cost per ratepayer.
Yeah.
And so the fee raise is to offset the required fund gap of approximately $2.1 million. And so so that's what that fee is increased in the, purpose behind it.
Does that include the litigation and the
Well-
manager costs?
I can give you like the estimated costs required to be funded by the revised groundwater extraction fee, include Prop 1 application budget tables, revised IWBGA support costs, City of Ridgecrest reimbursables, advanced agreement between Kern County and IWBGA, advanced funds between Indian Wells Valley Water District and IWBGA, final Prop 1 funding recommendations, and final Prop 68 round 3 final award list. So those are just some of the lists, but it's basically filling that fund gap that we have from, start to where we are at this point. And so you bring up that it's a vast increase in the amount. The first number, $30 fee that was, agreed on, wasn't enough it was undershot. And so the new fee would bring us back up to point. And the way it's playing out, the cost per ratepayer isn't going to be that much. It's set at $218, and over, say, an 18-month period, that appears to be a finite, parameter. So if you're asking, is that a can't be changed, is it going to stay there and then end at the 18 months? That would be my assumption, but that's my assumption. I mean, that'd be a good question to firm up, from the board. I couldn't probably answer that just on my own, but that's
Yeah.
the parameters, I think.
Like,
So-
I guess I'm uncomfortable with the idea of saying, go ahead and raise that fee up, and then is it going to raise again, and then is it going to extend out for...
Well, that's speculation, pure speculation on.
Right, and that's
but
what I would just like to see.
There's parameters that they have set here, and it's pretty,
If they adopt it, I'd like to see it's capped at this for this period of time.
I mean, that's a good question. You could, you could write that up and, have that as a formal question to, be answered. But I think the numbers and the parameters are pretty straightforward.
Remember, part of
But they're
those
not
numbers-
fine-tuned yet.
All right. Did you want to, part of those numbers were based on figures that entities said, this is how much I'm going to be using. And then when they actually found out that they're not going to be using 7,000 or 8,000 acre feet a year, they're going to use 3 or 4. You based your expenses on this is how much water you think, and you based your expenses, you based your rates on what they've said they're going to be using, and it isn't.
Right, no, I understand that, but we also went over our costs significantly too. So I understand that people didn't pump as much as they said they were going to, but then we also spent more than what we originally planned. Like, when we first, way back when, voted on choosing Stetson, their bid was $250,000 for the GSP versus the other company was $1 million something. But then now Stetson's costs have been much higher. I mean, we've seen bills for $100,000 a month.
So, but basically, I mean, regardless of that, as to why, the numbers are where they're at, the pumping fee is based to pay for the GSP. And so in this offset it. And so, and the
But does
amount
it
that,
include legal fees too? Not just the city reimbursement legal fees, but additional ones. My understanding is that like $600,000 in legal fees included.
in the formation, development, and adoption of the GSP?
Future legal fees that haven't been spent yet.
Well, my understanding is that it's for the whole GSP in itself. So I don't know, I can't answer if litigation is included in FE. I don't see it in the paperwork, but I mean, it's a good.
Okay, and and then there was some questions about, like, I think Sam had mentioned this at the last meeting, the posting requirements. I have concerns we're not meeting the 72-hour, and then there was another question about the 20-day posting requirements for the fees. Have we met those?
My understanding is that we have, and listening to, council speak in the last meeting, I believe some of that was addressed. So you might refer back to, or it'd be a good question for Phil Hall, but some of these issues were addressed through the council. And my understanding in listening to them is that, yes, we are meeting, the appropriate requirements that we need to be meeting and operating within.
Are the meetings going to be open to the public?
I don't know. I mean, based on the COVID, I don't know if they have opened up the.
Just because with these fees, it seems like it's important to make sure that public will be able to be there, and because the phone thing doesn't always work the greatest. And I know there was a lot of people heavily attending those before. So it seems important that those would be opened up if we're passing a fee potentially tomorrow and next month.
Well, remember that those people that filled this room will not be able to fill this room because we have those seating requirements that they have to have. That's why we're encouraging people to still continue to call in. But if you're going to think that you're going to get a couple of hundred people in here, you aren't going to.
No, I understand that.
Well, and actually, the groundwater meetings have gone pretty smoothly. I mean, we really haven't had the same issues that we had like with the city council meetings. So it went pretty smooth on people being able to call in and speak and participate in the meeting. So
It just seemed like when I watched the one last month, like people would call in, they might say their point, and then they would hang up on them, and then they would be like, maybe something, I didn't catch all of what that person said, but they had already hung up on them, so then they didn't, and then the other thing, just a comment, Mr. Hall's demeanor to some of those responses, I think, was kind of inappropriate. He would say, I don't even think that's worthy of a response. I don't think that's inappropriate for someone who's being paid with tax dollars to basically insult other people's questions. I mean, I understand that may be how he personally feels, but it seems like he should be maybe a little bit more tactful in his responses. And
I don't know that's for me to.
I know it's not, but
I'm not going to speak for Mr.
Yeah.
Hall. And
I just wanted to make that statement publicly that I don't think that's
so
appropriate.
I don't think that's I don't know if that's even anything for us to be discussing at this point. So.
Okay, is there any other comments? Any other comments from the public?
I'm speaking for myself. I'd like to clarify a couple points that were brought up by the councilwoman. The number of pumpers that are included in the pumping fee has gone down. The farmers are not included, and I think the total amount of water that is included is now down to about 10,000 acre feet. Maybe it's a little bit less. In my perusal of the ordinance or whatever, even though they calculate a fee based upon 12, 18, or 24 months, I see nothing in it that actually says that that is the sunset date. So that does need to be clarified one way or the other. I don't care if it's 12, 18, or 24. We need to have a date, it might feel, and I think you all need to know that too, and you should know that before you vote on it.
Well, Stan, are you saying if they adopt a 12, 18, or 24, it isn't 12, 18, or 24?
Not unless it's stated specifically
if they're
to
adopting
be
it for
12, 18, or
24
24. What happened is they calculated the fee based upon a given pumping and a certain amount of time. That's all fine in terms of calculating the fee, but you still have to, as part of the ordinance, say it sunsets at 12, 18, or 24 months. Because obviously the initial pumping fee that was supposed to go for something like a little under 2 years has been going on, seems like forever. And of course, at 7 cents a unit for water, most people didn't care, but now it's going to be bumped up to between $100 and $200. So it's time we started caring. The last thing I'd like to comment on is right now it appears that the largest cost associated with that, depending upon, again, what it amounts to, 2,100,000 or something less than that, because right now I believe the water district is going to not take its money out. So it may be more like 1.6 billion. But nonetheless, it's not what the people pay in. You need to consider, what is the money going for? What expenses are you paying? And I believe that the most expensive item is litigation. The fee got bumped from 200,000, or the expense got bumped from 200,000 to 700,000, I believe. And there is a remaining 646K left. That's a lot of litigation. And in theory, it is supposed to be for litigation caused by the GSP. My feeling is, and this is me talking, not the water district, is that the litigation is caused by a management action imposed following the development of the GSP. The GSP is a piece of paper. It doesn't authorize anybody to sue anybody. Nobody gets harmed or injured by having a GSP. It's imposing a management action. So I think you do need to understand specifically what is in those expenses. Thank you.
Thank you, sir.
Good evening, Council. Mike Neal. I could easily go for 10 minutes on this one. There is so much wrong with what's gone on with this supposed groundwater authority. I could talk for half an hour without blinking an eye.
We can't give you that.
Yeah, I know that. You barely give me 5 minutes, but that's okay. I'll do it. Talk about the pumping fee. Here's what the board member, Ron Kaczynski, had to say as reported in the News Review. I'm trusting in their accuracy. He's saying the increase of the cost to Searles Valley Minerals is going to go from $73,000 to $543,000. The Unicurn Community Services District, you know, that little water district out in Unicurn that serves those people who most of them don't make very much money, it's going to go from $3,000 to $23,000. So he went on to say our costs have increased 66%. You can't run a business like that, because this massive increase, and it is massive, is 7.5 times higher. Mr. Gleason went on to say, oh, FUIO on a finance committee, we don't need a finance committee to look over things. It'll just slow us down and we won't get anything done. Well, I'd say to that, you should have had a finance committee from the very start, because the only reason we're all having to pay this pumping fee and then coming up to this huge replenishment fee is mismanagement on the part of the Groundwater Authority. They spent $7 million over the last 3 years. All of it's pretty much been to pay the overpaid consultants to do redundant studies to come up to a conclusion that everybody knew from the day they started what it was going to be. It's always been, 7,300 and something acre feet of recharge into the valley. We can't let it go below that. Oh, here's what we're using. I mean, I could have done it in 30 minutes on a pencil and a piece of paper and come up with the same result. And they spent $7 million getting there. That's what we're all getting at this in the pocketbook and getting to pay for. Now, the basin replenishment fee, that's a whole nother matter. And I'll tell you 2 reasons the GSP is totally inadequate. We shouldn't even be looking at this. Is number 1, they have not looked at getting any water out of the southwest well field whatsoever. Number 2, there's been no progress getting off the ground and some reality with the Ridgecrest wastewater treatment plant to get our 2,000 plus acre feet of water that would cure the problem for the water district, for most of us around that use water out of that district's pipes. That's half of what, about a little less than half of what they're saying they're going to need to import water. But yet they want to go out right now. They haven't even completed their job, and they want to go buy $10 million. They're supposedly not even going to buy. They're just going to get a bank account to approach buying $10 million of imported water per year. And think of this. They don't even have an approved plan. They only put it in January. They got nothing. That's why I told the Water District Monday. They have got nothing. It's like you went up to the DMV office and you applied for your driver's license and then went out and started acting like you had a driver's license. Well, you didn't have one until they give it to you. Well, we don't have a plan until the state says we have a plan. And yet, they want to charge ahead 6 months later at the behest of their lawyers, who were also the ones who put together the allocation table, which was never brought up before the public to get any determination of, and they want to go charge these huge amounts of money to the people in this valley. This is unacceptable. What this council should do in response is direct their representative to vote no on this replenishment fee altogether. Say, forget it, you're way ahead of the game, and we are not going to do this. If he wants to act like he's independent and can do it and decide on his own, maybe you need to get another representative to send that board who will face reality and realize that it's a farce. At this moment, it's a farce being propagated on the public, and it's going to cost us $300+ per year average just for the replenishment fee. When they get around to the infrastructure, which they may not need half of, it's going to be 3 to 4 times that.
Thank you, Mr.
Tell me how
Neal.
many bankruptcies and people
Mr.
going
Neal?
bankrupt you're going to see in town from that. Think about it.
Okay, is there any other public comment?
You got a phone call.
Okay. Caller? I know I was going to give him that. Caller, please identify yourself.
Yes, this is Elaine Mead, and I'd like to make a comment, maybe to Scott, since he is the representative. The GA staff and whoever is directing them are sending out packages so often and so many concerning the same package, the same item, that even Scott doesn't know what the latest one is. The latest pumping fee, extraction fee, is recommended by staff as of yesterday to be set at $105 for 18 months to replenish or to fund the required gap of $1.53 million. These numbers have changed so drastically over the last 45 days that I don't know how anybody could understand this. But the fact that he is your representative and he is the one that is supposed to be directing you, and he's using numbers that were way back in June, the first part of June, I'm very disappointed in him as your representative and being up to date. I may have some comments concerning the replenishment fee, but I will ask them at the GA board meeting tomorrow. Thank you.
Thank you. Okay. I see no other comments.
I had one more question. Have we received any state comments on our DSP that we submitted? Have we heard anything from the state on our submittal? No. Not yet. Do we have any idea when they're going to comment? No. Because we had to have it submitted by a certain time, but they don't have to approve it by a certain time.
I don't think they have a set guideline that they're, going going by, no.
Okay.
And so the meeting tomorrow, I wanted to confirm too, the meeting tomorrow is a virtual meeting. So they're sticking to the, close to the public meetings and doing it virtual.
Hey, Doc, who makes that call?
The board itself. So,
One of the things I did hear, and I didn't hear it directly, was that Kern County has not opened their meetings up yet to the public. And their concern was maybe staff won't be able to be there if we open it up to the public, because those were Kern County's rules.
right, and then to have, just a few days ago, the rumor that we were going to be getting shut down by Saturday, so even our city council meeting went from closed to open to, so there's still a lot of, volatility in making a decision on whether to be open or not. The county, like you said, they haven't, to my knowledge, opened their meetings either.
And so, Doc, one more question. This is just a general question. You guys are getting down the weeds. I do not envy you being the representative on this board. It seems painful, and it's probably going to get more painful as the days go by. The mailer that went out, right? I'm hearing and seeing an overwhelming feeling of protest, right? And so, if there is an overwhelming protest to that data they're in, what is the ramifications? And I know you can't answer every single question down to the very last, detail, but I'm sure that you've discussed what the ramifications are at some point.
Are you referring to the Prop 218?
Mm-hmm.
Well, I think it pans out on what the end results of it are. As it moves through the process, I mean, that's going to be the telltale decision on whether it goes through or not, a few outcries. So, I mean, does that
It's really unlikely that
answer your question, I hope?
they have to have 51% of what you guys mailed out, like 19,000 of those things. So you would have to have basically you'd have to have 10,000 people.
Well, to speak bluntly, I've not heard one person that wants to advocate spending more money on an additional bureaucracy. And that's not a dig at you. It's not a dig at anybody else. That is all the comments I've heard thrown at me. So I was just asking, what is the ramifications? So the assumption is it's going to pass.
Right.
Right?
Well, I'd be that, you could assume that.
It seems like, okay, all right.
And so, the data that I'm giving you guys, contrary to what, you hear, this is the packet from last month. So it's not, early June. This was, the data that we looked at, during the last meeting. And so that's why I kind of qualified that with a little bit of that number and that time frame is still to be, ironed out. And I didn't want to put an exact amount to it, but those numbers aren't old data from ancient times. It's relatively current things that have been changed. When it's completely finalized, I could give you, so it's easy to report on it after the fact, after it's, been finalized and voted on, but then to give you, an exact number at this point in time. But I think it's pretty clear that, taking these numbers that we have and we're current as of, the last meeting and giving you some data on that isn't, old data.
Didn't take it as such. And is it okay for us to hope that you will urge a given finite time limit, right? We've just heard it discussed a lot this evening, right? Otherwise, a no vote. Is that an acceptable?
Right.
Right, because I've heard it said before, because I don't know how many times I'm reserving a lot of comments that we really only get to kind of hear back from you. The city council, you are a representative. We don't get to tell you how to vote or not to vote. You still make your own decisions, and that's understandable.
Correct. And the numbers that we went over last month, were assumed to be pretty reasonable. Nobody had a fit over, the amount that Mrs. Stevens had come up with, and I assured her that it actually was going to be lower than that. And now, it's maybe safe to say it's going, going to an 18-month, and if the fee's lower, it's going to be even lower than that. So contrary to, what we hear, from various sources that, it's, this terrible fee is going to be, this astronomical amount, it's not the boogeyman that they're projecting it out to be. This fee is, at this point, that pumping fees, I think, is a very, reasonable fee. And being, looked at in the perspective of, keeping it low on the ratepayer, so.
Sure. So, well, so even if it's a reasonable fee, given the amount of variables that I've heard just tonight, not to mention the past, we don't need to talk about those, but we've discussed tonight, is there's an immense amount of variables in this equation to what it's going to cost, the amount of time, this fee, that fee, what's included in this fee, what's included in that fee. I think it's a reasonable expectation to want to just set a time limit, see where we're at. But an actual written down in an ordinance time limit, like, look, this is what we're paying, this for this amount, we'll renegotiate, we'll figure it out as we go. I mean, we do that on the city council all the time.
Right. So I think their parameters that they're setting are pretty consistent with, the 18-month and, but I can report back on that, even more. The bottom line is, what we're doing, as a GA is, it's going to cost money. There's no doubt that we're going to have to pay for what we're doing. And we're behind the curve, have been for many years on getting water sustainability and making a positive change in this for our future. And so is it going to cost? Yes, it's going to cost. Are we going to try to do it in a way that it's going to be reasonable and acceptable? I think that's the goal. And, we're looking at it from the city perspective. Mrs. Stevens, I don't know where you're, we're city council people. We work for the city of Ridgecrest, correct? But I hear a lot about county stuff, so, I mean, where do you stand on it? Is for benefiting the city or special interest or outside groups?
I stand for, I have concerns over the citizens of Ridgecrest. We're represented by the county, the water district, and the city. If we potentially are going to get, like, the costs that we're going to see are going to hammer us harder than most other places because we're represented 3 times over. So our representative of the county has already paid $500,000 in. Our water district people have already paid $500,000 in. We're spending money as the city. And so I have concerns that the local people's rates are going to go up. I also, though, have concerns about hearing Cerros Valley. That affects citizens of Ridgecrest. If Cerros Valley closes down because they're seeing this pumping fee go up to $500,000 and then the replenishment fee of $5 million, that means if they're put out of business, we have 500 families here in our town out of a job. That's a serious issue to me. So I don't like the accusation saying I'm representing special interests. No, I'm concerned about our citizens, and I'm concerned about the amounts going up. Things are not nailed down. We keep hearing things are being fine-tuned and ironed out, and so it doesn't make me comfortable saying proceed forward with voting for this cost and raising it to whatever you may raise it to when we don't even know what's in the, like, what the costs are. Those change all the time. The dollar amounts are changing all the time. The length of time that it's going has changed all the time. That's a serious thing.
But they're changing in a lower denomination to make it better on the ratepayer.
Well, just like
in regards to the pumping fee.
If you go out and buy a car and they want to finance it and they say, well, what do you want your payments to be? You want your payments to be $200? That doesn't mean they're reducing the price of the car. They're lengthening the time of the loan. So we also need to look at it that way. It's not just because they're saying, well, it's going to be $100 an acre feet over 12 months. That's not reducing necessarily the cost. You're just reducing your monthly payment, but you're still extending it out.
Thanks, Doc.
Okay.
I know
All
you're
right,
taking
no
a
more
beating.
direction. All right, we'll go on to the next item. The next item is a resolution. I'm sorry, you guys told me you couldn't hear with it on. A resolution of the Ridgecrest City Council authorizing the acceptance and administration of a military installation resiliency grant from the Office of Economic Adjustment for the amount of $493,670. And if you would address that for us.
Good evening, Madam Mayor and members of council. So before you, you have a offer from the Office of Economic Adjustment for $493,670, which was justified through a budget justification in our application that was proposed by Mr. Ron Strand at the invitation of the Office of Economic Adjustment and the nomination of the NOS China Lake. There we go. So the background and purpose of this grant, it's a new grant. It was introduced in the fiscal year of 2020, and it has its own catalog for federal domestic assistance, its own CFDA number. This stems from encroachment grants that are similar to this. And this grant has been developed to assist communities to develop strategies to protect resources from both man-made and environmental threats and vulnerabilities, in growing the capability to minimize the effect of, adapt to, and recover from extreme and unanticipated weather changes. It's also to anticipate conditions that may adversely affect the military installation or resources outside the military installation. And so the main purpose of this grant is to get the MIR deliverable. And this deliverable is a singular cohesive document. And this document will be a comprehensive, cohesive report that shall identify, analyze, and allow the stakeholders to address both environmental and man-made threats, vulnerabilities, and provide infrastructure analysis. And the deliverable is composed of two components. For the NOS MIR study, that is the Environmental and Man-Made Threat Report, which identifies different vulnerabilities in our area, and the GIS data, which will map, give a visualization of all of these. So some of the anticipated risks and impacts we can expect in this report will be flooding and tidal surge, wind. We have extreme wind here at times, drought, and drought can be broken down into overdrawn water tables and anticipated climate changes. Wildfire, earthquake, and of course the impacted aspects, things that we can look at changing with this document. Water availability, storm water, wastewater, installation energy, operational energy, or the logistics infrastructure, transportation, or logistics, the installation access, and the communications. I apologize. And I mentioned earlier that we will have a stakeholder group, and this stakeholder group will serve as a steering committee and policy committee for technical assistance. It's made up of groups such as NOS, Kern County, China Lake Alliance, IWVWD, and IWVGA. And each of these stakeholders will provide local experience and expertise to help inform the direction that we need to go with this deliverable. So what's our role in this? Ridgecrest's role in this is to support the effort and administer the OEA grant, to provide staff time and expertise, ensure community-based input and participation, seek and coordinate federal, state, and local resources. Now, the OEA, the Office of Economic Adjustment, will be here to provide guidance to initiate and conduct and complete the community-driven project, provide technical assistance to the local jurisdiction and installation, provide funding assistance to the local jurisdiction to conduct the project, and facilitate communications between the local jurisdiction and the installation. And the role of the installation, as they have done, they have recommended and supported the grant nomination, represent installation interests, provide leadership, guidance, technical support, and expertise to the stakeholder steering committee, and provide data and comments on draft deliverables. And of course, the stakeholders, the last component of these roles, will serve as technical and policy steering committee, represent a diverse group of local interests, provide data, and meet regularly to review data on the deliverable progress. So as we look ahead, I think it's important to note that all of this will be completed in the unclassified domain. And these further grants that you see in front of you, can be achieved after we have completed the deliverable. This will give us data that we can use to complete action items, such as looking at energy grid resilience, as well as imported water connections. So this data will not only benefit the base, but it will benefit each stakeholder in moving forward for infrastructure and other data-based needs. Thank you.
Any other questions? Council? Public? Okay. Oh, I see. Sorry. Thank you. Caller? Caller, please identify yourself.
Yes. Good afternoon, or good evening, Madam Mayor, council members, Ms. Schlanta. My name is Richard Wagner, 408 South Lincoln. I'm calling because it seems like in many of the meetings, we keep hearing we're going to hire a consultant. We're going to hire consultants. We keep hiring a bunch of consultants. And like in this case, with the IWVGA just hired a consultant to do an engineer's report on the water. And looks like we're going to do the same thing here. Is this going to be a different consultant, or are we going to compare data, or is it going to be the same consultant as the IWVGA's? I mean, I just feel like maybe we're duplicating efforts. Can we not take previous reports and use that data?
Yeah, Mr. Wagner, that may be correct. They may take data that's been generated by the Groundwater Authority and Water District and issues throughout the history of the valley, but this is a grant that is sponsored by the Office of Economic Adjustment. They needed a entity outside the government to administer it, to take the lead. There will be a consultant that is hired that will reduce our staff's work in this matter. I do believe it will be a different consulting group. And what they're looking for is resiliency both for the Navy installation as well as the community so we can move forward. And this is a report that the Navy needs to be able to justify any future MILCON projects or other grants that the county, the Groundwater Authority, the city may apply for. So this is a very good foundational document that will be established to be able to reference for any sort of grants or federal funding in the future.
Just to clarify too, because it sounded like he thought we don't have costs. We're accepting the $493,000 grant.
Correct. Our portion of this is in kind. It's my time. It's Corinne's time. It's overhead time. That's how we meet our 10% match. But yes, we will initially, this is a reimbursable grant. We will pay the consultant, but on a monthly basis as the bills come in, we can seek reimbursement from the OEA.
Okay, thank you.
Any other questions for the council? I know. Did you get your answer, sir? Hello?
Yes, I did. Thank you.
Okay, thank you. All right. Public?
Heard that the city's part is all going to be in kind. We're not taking any administrative costs from the monies of this grant or anything of that kind.
No, sir. In fact, our administrative costs will go towards the in-kind amount. No, we will be receiving no funding regarding this. The funding that we get will be the funding that will pay for the actual administration of the grant, the hiring of the consultant. I do believe there might be a small amount in there for some materials, I would assume, maybe a laptop or something, but nothing for my time or Ms. Shalanta's time. That will be our in-kind match.
Okay. I glanced over this, and I have to say I agree with Mr. Wagner. The waters issues that are in this, I mean, those have been done and redone and done and redone. We know so much about the water situation in this valley that you could stack the paperwork up 3 feet high, literally, and yet another one of these high-paid consultants get to come in. And basically, he's just going to collate the data from the water district and the GA in the Cooperative Groundwater Management Group and throw it in these reports. The rest of the stuff, I mean, is,
Well,
like
Mr.
I
Neal,
said, you
you're-
could do it on the back of a piece of paper. How hard is it to figure out that where your electric power vulnerability is? You got power lines coming in from down south. Blow them up. We don't have electricity here. That's not too hard. And how are you going to mitigate something like that? Well, you put in redundant power lines. Well, yeah, good luck with that one. How about the communication? Well, we got, internet cables coming in. Where are those? If you want to, interrupt our communications, then go cut that in half or blow up the line somewhere. How hard is that? $500,000 to figure all this out? The council keeps talking like these grants are money that fell from heaven. It's not fell from heaven. I'll tell you where it came from. It came from right here and all the rest of us. We pay taxes. They come up with these programs. This is literally a waste of money. That's all it is. And we're going to help them spend $500,000 and get rich off of us, doing a bunch of copy and pasting is what it's going to amount to supply the Navy with things that, I mean, it just blows me away that the Navy can't just task some of their little admins over there to collate this information and provide it, because that's really all it would need. But here we are once again.
Okay, is there any other public comment? Any other council comment?
Is there any indication of the PowerPoint that I had seen from before when they first put this out? We're being compared against 25 other bases. It listed 25 other bases should complete this.
It's not a comparison. It's actually that 20 installations have been selected for resilience efforts. So it's a group effort to address all of the resilience concerns at each of these installations. Ridgecrest and China Lake were one among 20.
Okay, because that was one of my concerns. Is I don't want to. I just didn't want it to seem like this was sort of like a BRAC, but in disguise, kind of a thing. And we have these 20 other bases. We're writing up our report, kind of signing our death sentence here, because a lot of those categories we have significant issues in, and maybe some of those other bases didn't. And so that was one of my concerns, is that we would highlight our problem areas in this document, and they would say, "My, that's a lot of cost." So
I have to apologize. She did have a slide in there describing that, and I asked her to take it out. So
okay.
Hey, I have to take credit for that one.
Okay, is there any other questions?
Madam Mayor, I
Okay.
have one amendment that needs to be made to the resolution, if I could entertain that for a second.
Please.
We need to add to the now therefore be resolved item, a new item 3 that states authorize finance director to amend FY20 budget revenue and expenditure to accommodate this reimbursement grant. We did put the line in there to adjust the grant so we could have the revenue and the expenditure for this.
Okay.
I make a motion to approve a resolution authorizing acceptance and administration of a military installation resiliency grant from the Office of Economic Adjustment for the amount of $493,670.
Second.
So I have a quick question for Lloyd. If, like, my husband is employed through the base, and since this is related to the base, is that okay for me to vote on?
Okay, well, can you hear me?
Yes.
Do you hear me?
Yes.
Okay, thank you. Lloyd Pilton. First, I would just like to say to all the council members that when you're reviewing the agenda, these are good things for us to look at long in advance.
Sorry.
Before the meeting. So now, help me out here, Ms. Stevens. So your husband works on the base, you're saying?
Yes, on this military installation. And so I just wanted to
Right.
double check that doesn't affect, since it's for basically the military installation.
Right. So do you imagine that this will have any effect on your financial interests? I mean, the fact that he's your spouse, that's important.
I agree.
But this is
I'll just
So
abstain.
that is
That way
relevant.
it's clear.
So real quick, so I also,
Yeah.
work for the government. It wasn't lost on me when I saw it as an agenda item. As I understood it, Lloyd, the only reason I would need to abstain is if for some reason I was going to, myself, my job, going to be in some way financially impacted, or the people I work for, there was going to be a direct.
Exactly.
Right.
That's right, and that's the case with Ms. Stevens as well.
Right.
So, does anyone hear anything in this resolution that sounds like it would have an effect on your financial interests?
Not personally, no.
Lloyd,
I'm not hearing anything.
Lloyd, this is Ron. In review of this grant, it doesn't appear that either Ms. Stevens' husband or Mr. Blades would have any financial benefit regarding this. This is a third-party grant. It's a group of stakeholders getting together. This report covers both the city of Ridgecrest and the base. Its primary purpose is for the ability to seek funding for resiliency projects, which I believe has really very little to do with either one of their employment statuses on the installation.
I see no conflict of interest here.
With that said, they've already voted, and the vote is 4 ayes, 1 abstention by Ms. Stevens. The vote does pass.
Thank you. Okay, the next item is a resolution of the City Council authorizing the city manager to enter into a memorandum of agreement with Sierra Sands Unified School District for a law enforcement services school resource officer program. Sir.
Good evening, Council. Before you, it's that time of year to renew our agreement with Sierra Sands Unified School District for the SRO position, school resource officers. And this has been going on for many, many years. It used to be one, and in 2013, an additional one was added through a COPS grant. And when that grant ran out, then between Sierra Sands and the city, we have continued the second SRO, and the school district has agreed in the agreement that they will reimburse the city 1/2 actual costs for both of those officers. And the financial impact, we should receive about $151,000 back in reimbursement. So with that, staff recommends that approval authorizing the city manager as designee to enter such agreement. Any questions?
Do we know if COVID will affect? We don't know yet.
No.
Okay.
No, not yet. They don't even know what they're going to do yet, so.
Okay, thank you.
Any public comment or questions?
Related, but ties in, I believe, very well. I made a suggestion sometime back that we have the police department bring regular reports to the council, both for the council and the public's information. And something like this, I mean, I would, be really nice to hear some information as to, crime trends in the school. I mean, I think a lot of parents would be really interested in that. How's it going? Is it getting better? Is it getting worse? What kind of things do the parents need to look out for, as related to, you know what I'm talking about, Jed?
We had that
things like that.
information at budget time when
Yeah, I just did
We
it.
also
And we also reach out to the parents and have meetings with the ones that are affected with their kids in school. But I'm happy to do that here too as well. It doesn't matter.
Also, the action committee that meets twice a year goes pretty heavily into that with the school resource officers. So, and that's open to the public.
Yeah,
too.
I know, but there's probably not more than a handful that even go, if any at all. So I'm talking about is council level reports to the public, gets out in the papers, gets recorded. People can sit back and listen to it later on. This is not unimportant information. This is actually important information, and the police department, other than what's on their Facebook page and the police logs, is pretty much in the dark as far as public concerns is concerned.
I disagree with that. Our department is open to the public. Anybody can join PACT and have free reign to the department, so I would disagree that you guys are in the dark on anything.
Well,
So-
I think it could be more in the light, let me put it that way. Thank you.
Thank you. Any other public questions or comments? Any council questions or comments?
No, so Chief, I wanted to commend you on how your SROs have been integrated into the district. Now, I'm sure that's partly district, which you guys are working together. To quote one admin that I talked to, you guys are elbow partners. I thought that I was going to call around and talk to different faculty and admin and people who work for the district and get varying opinions on how the SROs are used. And resoundingly, every one of them were proud of the service that's provided. They said that the SROs do things that admin could never do, teachers can't do. If an emergency happens, whether it be medical or otherwise, there's an officer there trained to talk to, EMTs that's right there on the phone or on the radio, and they're there within a moment's notice. Not only that, I think one of the most positive things, sorry if sounds like I'm on a soapbox here, but is that kids are getting their early interaction with police is positive. It's a kind interaction. It's an education interaction. And I know that there is a concern in other states nationwide, maybe even other communities, but in our community, this is being done right between yourself, the SROs, and the school district. And so I just wanted to say thank you for letting that be a positive impact on our community and on our kids.
Thank you for having it.
And this school district hasn't voted to discontinue this, right?
It goes
Like
next,
Yeah,
their
like
next meeting,
some others.
Thursday, I think.
I should be against this because I remember a couple of years ago, my daughter had to take a car that wasn't stickered, and so I got a $53 ticket for her parking there.
Sir, you still haven't let that go?
Huh?
You still haven't let that go yet?
I didn't think about it again until just now.
Okay, is there a motion?
I move approval.
Second.
Please vote.
Thank you.
5 ayes, motion carries.
Okay, thank you. Okay, the next item is committee reports. Scott, did you participate in that question that they asked, whether we were going to have one? Finance Committee?
Finance, I believe it's been canceled.
Yeah, okay, that's
Yes.
right. Okay. You want to report that?
We are reporting that the Finance Committee meeting has been canceled.
Thank you. Well, we had a good reason. We just finished the budget. We haven't got our numbers yet, and so I thank you. So it wasn't just willy-nilly. Okay, Infrastructure Committee,
Meeting is next Thursday, week from tomorrow.
Economic Development,
Haven't met.
Parks and Rec.
Haven't met.
Is Melissa or is someone giving a report?
Yeah, there is no report at this time,
Okay,
or I should say nothing reportable.
okay. Other committees, boards, or commissions?
Yes, we have Kern Cog tomorrow, and actually Bard and I are going to be calling in. There's actually an item on the agenda that affects us. Some CMAQ money that was committed to something else has been pulled off of that and has been moved up forward for us for our solar panel project for electric vehicles, and that should be approved on the consent calendar. If it's not, then Bard and I will argue for it. Transit bus, yeah.
Okay, any others? Okay, the next item, City Manager's report.
Yes, Madam Mayor, members of the City Council, I got 5 items tonight. First is that, just to give you an update, we received some bids to fix the gazebo out back. We're estimating it's going to be between $23,000 and $25,000 to fix. It was within this year's budget. As you know, that facility is in disrepair, and we're hoping to get it fixed and updated and repaired before the Parade of the Thousand Flags. We're also, if we can afford it, we're going to attempt to put in some sort of speaker system without outdoor speakers, so then when we rent that location out, or if we need to use it for public events, we will have the sound system already there. Second item is we're looking to have the bathroom installed tomorrow near Freedom Park by the splash pad. We're hoping to maybe coordinate a safe ribbon cutting next week. If the council wishes to do so, I think that, even though it's a bathroom, it's still very important. It's a very important.
Going to dedicate a bathroom, huh?
Yeah.
Well, we've had the Freedom Park's been there over 30 years, and there's been no bathroom facility there for the community to use for the gazebo or the splash pad or the fields out there that they use for soccer and frisbee golf and everything. So I think it's an important feature for the community. And I'm very proud that we were able to push that through. I know Ms. Stevens, was a big factor behind that. Third item, we're looking at we had 3 light poles at the softball fields at Leroy Jackson Park. They were in dangerous condition. They were the base of the lights were degrading. The poles were leaning. They became a danger, so we hired a company to come fix them. They should be done this week. We were also notified today that we received $177,000 in Prop 68 funds. That's the funds we've been waiting on for a while for a park project that will be going to Quality Life for vetting and a selection of a project. We're also looking at another park grant that can be awarded up to $8 million. It's a competitive grant. Some of the areas that this grant will cover will be the renovation of specifically swimming pools, splash pads, aquatic centers, as well as a whole sundry of other park amenities. So that may be something that we use or we apply for to upgrade our lights at the ball fields to save the football, soccer, and baseball leagues funding, so they don't have to pay for those expensive lights. Or we could use that to focus on fixing Penny Pool. That will be going to the Quality Life meeting in August, as well as the other grant for discussion to hopefully move forward. That would be one of the ones I'd recommend that we'd have attempt to find an outside consulting firm that could help us write that grant. It is a competitive grant, and it's on a point system. So I do believe that that is something we may be able to qualify for and get some funding to be able to maybe fix the pool. And that is all I have this evening.
Thank you, sir. Any questions? All right, the next item is future agenda items. Anyone?
Are we going to add on to discuss looking at sending a letter for the council, or we had the discussion this evening about are we going to have a discussion item on moving forward with being looked at East and West Kern?
I do believe that Mr. Constantine is going to be reaching out to the state. Yes. I sent him a text message, told him I'd call him tomorrow to discuss this with him further. I do believe that probably our best effort on that would be to work both with the county and the Ridgecrest Regional Hospital and the city to determine, whether or not we want to go that direction, because there are benefits, but there are drawbacks, in my opinion, of isolating ourselves just to our own area, because it does lower with the testing going down, it will lower our numbers and will put us at risk of being one of those cities that could be put on the watch list. So I think that I do believe that Mr. Constantine stated that he would be getting hold of the state, the governor's office, to follow up on that. And I think they have by far the most influence in that.
Okay.
And the governor already has your letter, so he's already been apprised, or at least the staff's been apprised that the city of Ridgecrest is interested in that. But I think having the county as partners on that to be able to describe. I know we have another area within Kern County, the Kernville, Lake Isabel area has less positives than we do.
Right. I mean,
so
down south of us too, a large area down south. When you click around on the county dashboard, there's a whole area.
Yeah, Cal City is.
Cal City's as high as we are, I think.
Yes.
Yeah,
they
Cal
have
City's a little
residents.
high. Roseman, Palmdale, I know that Tehachapi's numbers have gained considerably, but I think that, the two areas that I think, could have a justification for some sort of separation would be us and Kern River Valley. But like I said, my caution on that is that if we become our own area and our hospital is the only hospital that we have to determine whether or not we have a surge capacity, we have 16 beds. And I don't know if I want to be betting our businesses on 16 beds because they can get filled pretty quick, as well as if our testing is dropping because of lack of supplies, what's that going to do to our percentage of positive tests? So there is an argument to be made that the larger your pool of making these determinations are, the better off we are. But I do agree that if it gets worse on the western side and it doesn't get worse on the eastern side, then yes, there's a compelling argument to be treated differently. But we just have to be careful in how we look at that.
I'm still, like I said earlier, concerned that with the amount of people coming in from out of town that we're going to surge. But, over on the news, some areas of Florida are reporting 80 to 90% positive tests, which seems, I think they're looking into that because it sounds weird. So.
Yeah, our concern is the rebuild of China Lake is coming. The temporary employee housing camps, on the Navy land to the east and the west of us are more likely going to happen. I don't know if we're going to have any within our community. I do know the base is going to require a COVID-19 plan from anybody that is housed there to be able to ensure that if there's a spread, it doesn't get out of control. I know that Mr. Sewer's been in contact with some of these MACs and GCCs that are bidding on these contracts as part of their COVID-19 plans. I know they've been reaching out to our local hospitals. So there is a lot of moving parts, and we are going to have a lot of bodies from more likely all across the state, in some cases all across the nation. So we're going to be careful moving forward.
Yeah, I just have concerns. Hearing him talk about their modeling scenario, I just feel like to ask our businesses all the way out to February to potentially be toggled back and forth between open and closed, potentially analyzed every 6 days, that's pretty terrifying prospects and as business owners in the community. And so I think it's just something we need to show that we're making sure we can do what we can for them. And I want to stress too, I think being responsible when you go out in public, practicing your social distancing and mask wearing, Assemblyman Fong said that was one of the top things that we can be doing to help our businesses. And I know Mayor Breeden gave a speech on that last time. And so it's just, hearing them say, they're analyzing us out, into February next year, that's concerning.
Well, the models change every day. I mean, I think that some of the activities we had at the beginning of June throughout the nation had an impact on where we're at today. I don't know if it's so much people sitting down in the restaurant eating dinner, but I do think that some of the behaviors that were exhibited and people starting to travel around the country. So yes, I agree that, that the precautions that we can take as individuals, however you feel about it, we should at least give it a try, because we do need to keep our businesses open. We do need to keep our economy moving, because at the end of this, we still need to have, people complain about the restaurants. Well, if you lose half your restaurants, you're going to complain twice as much because the ones that you didn't like, you're going to wish you had. So we need to continue to support our restaurants. We need to continue doing the dine out or, delivery, or if, as long as it continues, we allow them to put their tables outside or however they can so we can keep them open.
I find it interesting that back in March and April, that when Walmart and Home Depot, our two biggest retailers, were not enforcing masks, and we didn't have any surge. Now that everybody's enforcing masks, we're surging. Just an interesting thought.
I think equally as important as wearing a mask is paying attention to your health, your immune system. I think that's enormous. There's,
Well,
there's
that's
a lot
what-
of there's a lot of data out there to show that something to the effect of 90% of the people adversely affected by COVID are vitamin D deficient.
Well, yeah, 40% of Americans are vitamin D deficient, so we tell them all to stay home.
All right, so it's your health all the way around.
Yeah. I get my sunlight. So.
Well, as one of 3 business owners on this dais, I have to say that keeping our businesses open, I think, is our highest priority, as well as the health of all the people who live in this community. And I harped on it last time. Wear the face mask. It isn't going to kill you, but it will certainly, if we have increases that force our businesses to be closed longer, it will kill them. I've talked to so many business owners, and I've listened to them complain and cry about, what do I do? How do I plan? I'm open tomorrow, and then I buy my supplies to be open all week, and I find out I'm going to be closed. How do you do that? You can't do that. This is our new, unfortunately, normal. And if we can't do what's best for our businesses in this community, shame on every one of us, not just the 3 of us, but all of our businesses that matter. And that's why I had asked earlier that some of our businesses were asking for cover when they could just point to a letter. And so I asked Ron to help us try to get a letter from the governor that doesn't put the blame anywhere. And I'm not saying blame like it's bad, but the reason, the responsibility, because the governor's letter said people in California must, M-U-S-T, must, wear face mask coverings when they were in all these situations. And then there's equally a number of reasons why you don't have to. The thing is, if you don't have to worry it, it's not fair to the businesses to have to enforce it. I want them to be able to point to something. So Ron gave me this thing that I would like to make sure our businesses have available, so if they need cover and their employees, look how many businesses have had employees hurt trying to enforce this. Not at locally, God bless everybody, but elsewhere. And when tempers get up and it's hot and people say things or do things they wouldn't normally do, we have to be careful of that. So I want to be able to give them as much cover as we possibly
Peggy,
can.
I went into 5 businesses in Lancaster and Palmdale today, picking up materials to finish a house. And several of them had on their doors a statement saying that the state of California has mandated the wearing of masks. We require all people to wear masks.
But it's up to them.
Well, these were
Yeah.
printed things. They weren't handwritten, so I
Yeah.
assume they're getting them from somewhere.
Yeah, yeah.
But anyway, so I think there is things out there to do that. I agree with you.
Yeah.
The thing that irritates me about this whole thing the most is hearing these rich people on TV telling me that we're all in this together. That's a bunch of crap. You know, some of us have been financially hindered very well. When my little place closes down, I lose the rent. And that's a substantial amount of rent per month. So we are not all this in together. Some of us are hurting a lot more than others.
Exactly. And if you're a business owner, you probably are.
Yeah.
Okay, sorry, I didn't mean to preach. The next item we have is mayor and council comments.
I think I just made mine.
Okay. Anybody else? I have an announcement I'd like to say. I got to take this off because I don't want to cry into it. I have heard some medical reports, and I am not going to run again. I have to deal with those, and I love my city. I love my job. I love what I'm doing here. I think I've done a very good job. I've represented the people in this community as best as I know how. And I will continue, no matter what happens to me, to continue to come to committee meetings after the election. And I can speak. So you guys better be prepared, because all these times I've wanted to speak and can't, I'm going to be able to speak now. But, pardon me? But let me say thank you. I didn't want to do this, but I can see no other way, and I wanted to give people enough time, if they want to choose to run, to do so and take my spot that I didn't want to give up. But nonetheless, I appreciate our staff. I appreciate every one of you. And I'm not going anywhere. I'm still going to be here. I just want to be able to, I won't be able to devote the time, probably 30 to 35 hours a week I've devoted to the city each week, and I can't do that now. And if I can't do the job to the best of my ability, I don't think I should be doing it. So, thank you. That was my announcement. Okay. The next item is adjourn. So we will adjourn. Thank you all.